Last question from Bhavini was, while providing healing energy to her mother-in-law with both palms on the chakras, her left palm was sensing pain on certain locations, but the right palm could not. What does this mean? And not on the right.
It simply means that the right palm is still not activated while the left palm has been. So the important thing is that she should be happy, because at least one palm now has become sensitive. And once you can feel on one of the palms, then it is only a matter of time when you will be able to feel it on the other palm as well. So you are moving in the right direction. Sometimes it does happen that one of the palms gets sensitive and the other takes a little more time to become sensitive. But I guess she's on the right path, and probably in a couple of days, say about 20-25 days, if she can just keep on doing that particular practice, the other hand will also get sensitive. I'm assuming that there is no problem with the other hand. For example, some people, they have, I was just about an hour ago, I was talking to a lady. She had come to me, but she had numb hands. So there was a lot of less feeling in the hand. So if you have a problem with the hand, that is a separate issue. But if you don't have a problem with the hand, and if one hand has gone sensitive, the other will too. It is just a matter of a little time.
Excellent. Thank you. Thanks, Guruji. Next question is from Danny Ben Karai from the UK. In fact, I had a phone call this morning from Surat. When is the next Reiki course starting from scratch?
I never thought about it practically, because I thought let us bring to culmination and to a positive shore with what we are doing. But if there are more people, then you can take a lead and then we can think about it. I'll be available for teaching. Yeah.
Excellent. Thank you for that. Question 4 from Swati from the UK. So she has three questions, but she actually had another one. 3B certificates, any more attunements, and I have been watching Reiki on YouTube, is good, but waiting for Guruji to send the manuals.
Okay.
So,
there are a couple of things here. As far
yes.
as the level 3B is concerned, in this week's time,
Yes.
you will receive a note, a Word file, in which the steps will be given on how, by using whatever we have learned, when we start teaching, or when you start teaching Reiki, how are you going to perform the attunement? So that is one. The answer is, in the coming week, you'll get that file. Otherwise, everything I have given already. Now, the second thing is, are there any other attunements? So no, I have done the attunement for all the symbols. That means for all the levels together for you. But you know, the normal course is structured in such a way that they will, first we will do the level 1. After that, there will be a break for 1 month or 2 months, and then there will be a level 2. And then there will be a break, and then there will be a level 3A. So this way, the attunement has to be given at least for the first level, and then the second level, and then the third A level. Since we squeezed it in a month's time, so I gave the attunement at once. What the difference is between attunement in level 1, level 2, and level 3A is of the symbols. So in level 1, you are using only one symbol, or you're not using a symbol. In the second one, you're using the 3 symbols, and in the third attunement, you are using the Daikomu symbol or the master symbol as well. So when I did attunement, I did the normal palm chakras, I did all the 3 symbols of level 2, and I also did the symbol Daikomu of the level 3A. So we don't have any more attunements. Whatever attunement was needed, we have already done that. Now the next question is manual. Do you still feel you need a manual? Because I have given you all the symbols in a sheet. So you have at least the symbols which you need, and the explanations you have got. And 3B, where you need something in writing, I'll give you in writing. So I don't have manuals as such. However, yes, you want, I can tell you some recommended books which you can order from Amazon.com or Amazon.co.uk, and then you can have it as a reference book, just in case there is a need to refer to any kind of reference. You'll have that thing with you. The last thing which she mentions is about certificates. Yes, it came up when we started the course as well. So I have had a talk with one of the institutions here, because when you go in for a certification, there are two things which come. A is a certificate of participation, and the B is certificate of successful completion. And the messages which I received, apart from what you were asking me, from one or two people, they said that we are practicing Reiki, or we are already practicing some other healing art, and we would also like to extend the Reiki healing to our clients. So therefore, they needed certificates. So they would not need a normal certificate. They would need a certificate of successful completion, which authorizes them, or which makes them credible enough to give Reiki healing to others in front of their clients. So I have just talked with one of the institutions here, training institutions in New Delhi, and then probably, we need a small little quiz as well. So those people who would need that, just make a separate WhatsApp group. So if there are 20-25 people who need certificates, we will have some reasonable fee for the certificate. There will be a small quiz for the certificate, and after that you will have your certificates, because then they will say, we need a level 1 certificate, then we need a level 2 certificate, then we need a level 3 certificate, and somebody has got to keep the record, just in case somebody wants to check your credentials. So they are bound to call someone, and they call and they say that yes, the person did do a course and did pass this particular quiz. So in case there are some people, you just please announce in the, Nishaji, please announce in the groups, and then make a separate group. And if there are 20-25 people, I'll just talk with them and we'll sort this thing out and we'll provide the certificate. This is not an issue.
Excellent. Great. Thank you, Guruji. I haven't got this written on the Word document, the question, but I sent you a video on Sadhguru, who talked about Reiki. I think this was also sent from Swati. Did you have a chance to listen to this video? It was about, from Sadhguru, I think Isha Foundation.
Isha Foundation, yes.
Yes, that's right. I think this came up with a few people, that one shouldn't do Reiki. Is that right, Gayatri? It builds a lot of karma.
I don't follow him too much, though. I know him very well, but I don't follow him too much.
Okay. So
first of all, is something which I have not seen the video. Number two, it is not good to comment when some learned speakers speak. It's okay, they have their own point of view. I have my. So let my arguments not be against his arguments, since he is not there to clarify. So it is only once you are face to face, you can put your side of the story and the other person can put their side of the story. But largely, this question was answered in the previous class as well, in the previous question and answer interaction as well. Somebody said, something has to happen, let it happen. Yes, I told you that there is a sect in Buddhism which says if a rock is coming and you are meditating at a place, let the rock come. If the rock is not supposed to hurt you, then it will change its course and move from a different way. Is it as if just a few days ago, there was an India-China conflict? Even now it is de-escalating, the conflict is still there. It is as if Indians would have done nothing and just waited. Let us see if China has to do something to us, it will do, otherwise it will go away. What happens when your teeth aches? Do you go and visit a dentist, or you don't go and you sit and see if the teeth has to go in a problem? It will go in a problem, otherwise it won't. So let me stay at home. You don't do that. The God has given us intellect, and by using the intellect, we as the creations of God have tried to figure out certain solutions for our ailments. Had it been known, my argument is, or my understanding is, had it been not the God's will that we should heal ourselves or heal some of the ailments which we suffer from, then probably He would not have given us that kind of a knowledge base which we now possess. This is one. The other thing, if you talk about Sadhguru and what he speaks, so there are other things as well, because he does not believe in astrology, I do. It is not only a question of belief. I say, you come, I'll tell you about you. You put 100 people in front of me, and then you bring Sadhguru, and then you bring me, and then I'll predict about them, and then let us see. So it is not a question of belief. I know. So a person who knows, belief doesn't matter. Now I can see from my eyes. Now you tell me, I believe you can't see. The other person says, I believe I can. I know I can see. The game for me is over. I don't need to speculate because I can. Those people who can't see, they can speculate what seeing is. You can if you have did not have sugar, then one person will say sugar tastes like this, the other person would say sugar tastes like this, and you can have a debate. But to a person who has tasted the sugar, it's okay. The debate dies down. So, but since I have not seen the video, I'll not be able to comment any further on this now.
No problem. Thank you, Guruji. Okay, so next question from Hansaben in UK. Actually, she's Leicester. She gets numbness, so she wants to ask where she heals. The numbness happens. The numbness happens on both hands at night when she sleeps. So she feels afraid to sleep. Last night, I felt there was numbness in my spine. It comes and goes. Would you be able to guide me on this?
Yes. This is very important. Very important. A numbness has not to be taken lightly. Please don't take this lightly. Please go and visit someone. This is first advice. Now I'll tell you what we can do as Reiki healers. Now, since it is coming and going, as you said, it comes and goes. So it is in a stage where it can be healed. Slowly, gradually, it will go to a stage where this won't be, you'll not be able to heal numbness. Number two, you said that she is also afraid of this. So numbness and being afraid, I have explained that you go to the Mooladhara Chakra.
Yeah.
Any kind of fear, you go to the Mooladhara Chakra. Also for any kind of numbness, you go to the Mooladhara Chakra. And you give massage to the adrenal glands, either manually or through Reiki. So manual massage can also be given, and then Reiki energy and Chokure also can be given, and adrenals need to be activated. The moment the adrenals are activated, in the fright or flight response, you must have heard, they play a bigger role. So the fear will subside. So there is no need to fear. It is a question to act now, and you act on the Mooladhara Chakra. The second thing to be done is you have to figure out, because you mentioned both her hands and you mentioned night. Night is coldness, numbness is coldness, everything, fear is coldness for me. So everything is pointing to me regarding the kidneys and the adrenal glands. Go and check your kidneys. That would have been my professional advice to you if you were sitting in front of me, or I would have checked it on your hand. Second aspect of this is, since she says hands, I can't understand, does she act? Because a lot of people, when they say hands, they mean arms. So I normally tend to ask, although sometimes it becomes silly because the other person will say, I said hands. But then I have to ask. So there are two kind of things. When I, I am a trainer for the past 15 years, and what we do when we go to hospitals to train the nursing staff and the doctors, what do? Is we say, instead of giving a fatherly treatment, please give a motherly treatment, because the patients, they are not a normal human beings. They are under a lot of distress. So similarly, you know, we as healers, we have to give a motherly treatment. So even if a person is asking you the same thing thrice or 4 times, don't get irritated, because the person is not okay. People who come to us are not okay. So to treat them absolutely okay and then talk to them very rationally sometimes become meaningless. So a doctor telling a patient, you did not come to me on time, I will not see you, most of the times it becomes meaningless. We have to give a motherly treatment. In the motherly treatment, the mother is persistent, and the mother talks even about small little issues. So we'll ask her, are you talking about the hands or the full arms? If you're talking about the hands, there are a few meridians which are going through the wrist. So I will first give healing to the wrist. If you're talking about the arm, I'll go to this joint, the shoulder joint. There are 3 meridians going through the shoulder joint from the back and 3 from the front. There are 6 meridians. I will ask her, just before the numbness onsets, starts. Okay. Where does it start from? From the back or from the front? And that would be the exact, that will tell me the exact place from where I would start giving the Reiki healing. Okay.
Okay, Guruji, yes, I have answers to both, so I will relay that unless she's on.
Yeah.
Okay, so
Hello, yes, when I'm here, yes, the pain
hi.
start, pain start from shoulder, back of the shoulder, both hand, back of the shoulder to the last 2 fingers in both hand.
All right. So now she comes, now she says that it starts from the shoulder. So that is why I tell you, in your practice as a healer, in my practice as a healer and as an astrologer, we don't rely only on the words of the patient. We have to go by our wisdom, because there are a few common mistakes which people do make. And after you have healed for a number of years, 2, 3, 4, 5 years, then you will also realize that which are those areas where people are bound to do a mistake. And therefore, it is important for you to first clarify before you start to diagnose what is the cause of the problem. Unless you have the problem stated in the real terms, you won't be able to come to a diagnosis. Until you come to a diagnosis, you will not be able to go to a prognosis. Until you're going to go to a correct prognosis, how are you going to define a treatment for your client? It will become difficult. So now she says from the back of the shoulder. So from the back of the shoulder, we have the large intestine meridian, the spinal cord or the triple warmer meridian, and the small intestine meridian. These are the 3 meridians which run through here. So here is where we will provide the healing. Now you can't provide the healing here yourself, because your palm will not be able, it will be very difficult for you to provide healing over here. It will be better, in case Hansaji you can just mute your mic for a little while till I speak, then you can unmute. Okay, I'll mute all. So the point is that you start from here, but it is difficult for you to do it yourself. So in our group, if somebody is living next to you, and if you can form a group, and then they'll be able to easily heal this particular area. It is difficult to do it by your own self. But please do go to a doctor for this. Don't take this numbness thing lightly. Nervous system is something of paramount importance, and it causes diseases which are not easily solvable. And the coldness has already started. So I would suggest that you go for sun baths. Whenever there is sun, do take in more of sun. And whenever you will go to a doctor or a healer like me, he will also ask you about various other aspects of your life. Why are you, is there any problem in the life pattern, etc., because we want to know the basic issue.
Hello, yes.
Wait, ma'am,
yes.
please let me speak. Please let me.
Hello,
yeah, I will let you speak, but please let me finish. Because otherwise,
there was a problem, yes.
Yeah. So recently,
Unmute.
an old lady came to me about 7-8 days before, and it is Corona time here, and very near to where I stay is a containment zone. That means they have just cordoned off the area. So therefore, there is a lot of risk where I am staying currently. So this lady comes to me saying that there is a lot of problem, and it is a lot of urgency, and she belonged to the same place where I live in. So please help me. I said, okay, you come in the evening. She comes to me, she sits down and she says, there is a lot of problem in the hand. There's a lot of, and there's a lot of problem in the knees. And then she also talks about some other problems. I said, okay, I'll make sure that you are healed. But you'll have to first tell me something. She said, what should I tell? I said, what is the problem in your family life? There is no problem. And there were a couple of people who were sitting. There were 5-6 people who were sitting. They were my students of some different arts. So they had just come to visit me and they were sitting with me. And this lady, she's saying there is no problem. I said, ma'am, without the problem, you can't face these issues. She said, okay, let us start the treatment, do something about it. So I started the treatment and I started talking, because you don't have to take no as a no and yes as in yes very strictly. You have to be like what Bruce Lee said, be flexible, be like water. Okay, it was like that. Okay, I'll change my treatment. Then like that, I'll again change my treatment. I'll keep changing according to the circumstances. Nothing is fixed. So my memory is, or my rational mind behaves like a child. I say, this is a Jimmy, but then tomorrow, if I open it, and if there is a lead, I'll say this is a pencil. So I'll keep changing. So then she said, you know, my son, he is living somewhere else and he takes all the money. And my husband keeps fighting with my son. And for the past so many years, I have been the only scapegoat. I've been listening from him and from my husband as well. And, you know, it tears my heart apart, etc., 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 etc. Now she goes on, and now all my students are paying attention. Unless I solve the stressor, there is a source of stress. There is a source of problem in life. If that continuous bombardment is happening in life because of which the problem has arisen, how will I reduce the coldness? So if you are receiving a life threat, when do you receive a life threat? When Dawood Ibrahim calls you, or when you don't have enough money, or your future subsistence, that means living, is in danger. If that stressor is there in your mind, and if you say that my hands are sweaty, I can't do anything about it until I go through a regression session, I hypnotize you, and I take that fear which is attached, because I can't do anything about the stressor. I can't give you money and say, okay, you take money from tomorrow, you are financially free, so you don't need to worry about the future. You are worrying, you don't have money, now what to do? Somehow there has to be a disconnection, only then your solution is going to work. Otherwise, you know what she will say, I keep eating medicines, but I don't know why it comes back again. This allopathy is no good. You do something for me. So we have to be careful. Please, ma'am, please go ahead. Hansa ji, she's not here, I think. Her husband is here. Yeah,
Hello,
please.
yeah. It was disconnected. I can hear you now. But yes, it is serious problem. Is it serious problem, or I been to the doctors, and I have MRI scan as well, and I am on pre-gap medicine. It does help me, and I am doing Reiki from I have learned the level 1 from that onward. I am doing, and that helped me. But when I do some hard work, or I do some kind of washing up or gardening, it does happen in the night when I sleep. When I get sleep, all the pressure comes on my nerve. Then it happen very often. So
Madam, hello. Is she there or has she left? Okay, she's there. Are you there? Okay, then she'll see the recording probably. So we'll just ask her to check her C5, C6 and C7. C5 normally does have a problem when this thing is, when a pain in the arms is there. So there are the nerves from this region. They cause a problem. So what you do is, I'll tell you a small little technique. One is Reiki healing over here. The other is, again, in the last video I showed, take your thumb, the proximal phalange of the thumb and the downside, and then start rubbing it from the front, from this side and from this side. And if you find pain here, then keep doing that for 1 or 2 days, and then this will be okay, and then the arms will be okay as well. This is my first attempt at healing you. The first thing which I would have done when you would have visited me in person is this thing which I have told you. This would have brought, probably this would have worked. If not, then I would have thought about something else. Okay.
Thanks, Guruji.
Can you hear me, Nishaben?
I can, Hamsaben.
Yeah. So my next question is, what should I do for my fear? Because I had a really bad experience in a life, and that worried me a lot. But I forgot everything. But it's effect on my health. Now, is it possible to recover from the Reiki?
See, this is exactly what I had given you an example of. The moment you tell me a problem, I can understand from where this would be coming. Bad life events turn into coldness diseases. Coldness diseases are hard to solve. That is why I said that please do visit a doctor first, and then we'll do the Reiki healing on the side as a complementary treatment. Yes, the fear which you have can be worked upon, and you can be rid of this fear in about 3 months of time by working along with me. Means with your healer, along with the healer. That means the intention is there. You have an intention and you want to do it. Yes, it can be done. Once you don't have an intention and it has to be done, there are routes for it, but it becomes difficult. It is easy because you are willing. So if the person, for example, I am addicted to alcohol. So if I am addicted to alcohol and I am the one who's saying that I want to get rid of it, it is very easy. Any psychologist can help. However, if my father comes to you that his son is an alcoholic and you please get rid of him, get rid of this addiction for him, it is very difficult because the patient is not our things. For our things to work, we need that the person who has come to us, he does something. We are not doing any tantric philosophy or phenomena wherein some other person will do some other thing and you will be healed. So the fear which you said, the body has a memory. This is very important concept. The body has a memory. It is not only the memory in the mind, but the body has a memory. Although, and the science has proved it. I am talking about scientific facts with you now. So therefore, what has happened is the trauma has been such that although you are not remembering it day in and day out, although the situation might not be current, however, the body has absorbed it fully. It was something which you took it to your heart. And that is why Krishna says in Gita, the art of indifference, all it means is don't take it very seriously. I love my brother very much and tomorrow he dies. I'll not be able to live. Why? Because I took my brother very seriously. I took my love very seriously. So he says, do your duties, but don't take it seriously. Don't take it so seriously. So once you take your setbacks so seriously, the body also remembers those. And it then manifests in such kind of a diseases, which I don't want to even speak because I'm speaking with you. If you were not there, probably this would have been just a question. I would have spoken, but those are bad diseases, and therefore I said it is recommended that you definitely work on this with a doctor, or if not with a doctor, then an experienced healer. You have just learned Reiki. Let your learning complement what the doctor does. On any of the important issues, I have always stood that let us take the help of the person who has been doing it for a number of years. For smaller issues, it is not a problem. But still, if you were there and you were seeing, then I showed that this is called a thumb, and in the thumb there are two phalanges. This is the distal phalange and this is the proximal phalange. In the proximal phalange, near the bottom side, try rubbing this area and you will find pain. If you find pain, then at least in 1 or 2 days you'll be able to get rid of most of your current shoulder pains. This will go away. If it doesn't, then the second thing you do is contact a healer. First thing is you do this, and if it gets solved, it is nice. If it doesn't, then you solve a healer. The healer will work simultaneously on the body level, and secondly is on the emotion level. See, there is a body treatment. After the body treatment, there is a thought treatment. After the thought treatment, there is a emotion treatment. After the emotion treatment, there is a reason treatment. What is a reason treatment? Reason treatment comes from Karan Sharir. I told you there are 3 types of bodies according to the Indian people and according to the Reiki masters. And one is the gross body, then the subtle body, then the reason body. So the reason treatment is the highest treatment. What do you have for that? You have the level 3A for it, Daikomyu symbol. When will the Daikomyu symbol be used? It will be used in this kind of an issue where the setback has been such that it has penetrated the other bodies. We move on to the Daikomyu symbol. Is it okay, ma'am? This is what I had to offer, what I can offer from here.
Thank you. Thank you very much. But would you do from distance healing? Would you do for me?
Ma'am, that we can talk later, ma'am.
Okay.
Thank you.
Thank you very much. Thank you very much for your advice.
Most welcome, ma'am.
Thank you, Guruji, for this.